Xylazine, often called Tranq or zombie drug on the street, is a powerful sedative. Its chemical formula is C12H16N2O. Xylazine belongs to a class of drugs known as alpha-2 adrenergic agonists. These drugs work by depressing the central nervous system. This leads to sedation, muscle relaxation, and pain relief. Xylazine comes in a white or off-white powder form. It is soluble in water and alcohol. These properties make it easy to mix with other drugs. This is a major concern for public health. Xylazine is not approved for human use. It is strictly for veterinary use. Despite this, Xylazine has emerged as a dangerous adulterant in the illicit drug supply.
Xylazine is a valuable tool for veterinarians. It is a potent sedative and analgesic. It is often used for large animals like horses and cattle. Xylazine allows vets to perform necessary medical procedures safely. These procedures include examinations, minor surgeries, and dental work. Xylazine is usually administered intramuscularly or intravenously to animals. The dosage varies depending on the animal's size and the procedure. Vets are trained to monitor animals closely for any adverse reactions. While generally safe for animals when used correctly, Xylazine can have side effects. These include bradycardia, hypotension, and respiratory depression. Vets have protocols to manage these side effects if they occur. The use of Xylazine in veterinary medicine highlights its potency. It also underscores the dangers of its misuse in humans.
Xylazine's journey from veterinary clinics to the streets is a troubling trend that has caught the attention of many. Its presence in the illicit drug supply is a relatively recent phenomenon, but its impact has been significant. The first reports of Xylazine use in humans emerged in the early 2000s, marking the beginning of a new chapter in drug misuse. This was primarily in Puerto Rico, where it started to gain a foothold. The use of Xylazine then spread to the continental United States, raising alarms among health officials. It was first reported in Philadelphia in the early 2010s, a city already grappling with opioid issues. Since then, it has rapidly spread to other cities and states, creating a new layer of complexity in the drug crisis. This spread is largely attributed to its increasing use as an adulterant in heroin and fentanyl, making these drugs even more dangerous. Several factors have contributed to Xylazine's popularity among people who use drugs, making it a preferred choice for many. One factor is its ability to prolong the effects of opioids, providing a longer-lasting high. This is particularly appealing to those experiencing opioid withdrawal who are desperate for relief. Another factor is its low cost and easy availability, making it accessible to a wide range of users. Xylazine is relatively inexpensive to obtain compared to other drugs, which adds to its allure. This makes it an attractive cutting agent for dealers looking to increase their profits, further fueling its spread. Tracking the spread of Xylazine is crucial for understanding the scope of this emerging public health crisis. Unfortunately, obtaining accurate data on Xylazine use is challenging. This is because it is not routinely included in standard drug screenings. Despite these challenges, data from various sources paint a grim picture. Reports from medical examiners, poison control centers, and law enforcement agencies all indicate a sharp rise in Xylazine-related overdoses and deaths. The Drug Enforcement Administration has issued warnings about the increasing prevalence of Xylazine in drug seizures across the country. The geographical spread of Xylazine is also concerning. While initially concentrated in certain regions, it has now been detected in drug supplies in almost every state. This rapid spread highlights the urgent need for a coordinated public health response.
Section 5. Xylazine's grip immediate and long-term effects. Understanding the effects of Xylazine on the human body is crucial for developing effective treatment and prevention strategies. This knowledge helps medical professionals to better manage and mitigate the risks associated with its use. Xylazine exerts its effects by acting on the central nervous system, altering the normal functioning of the brain and spinal cord. This leads to a range of physical and psychological effects impacting both the body and mind. The immediate effects of Xylazine are similar to those of other central nervous system depressants, causing noticeable changes in behavior and physical state. These include drowsiness, slowed breathing, low blood pressure, and constricted pupils, which can be dangerous if not monitored. Xylazine can also cause hypothermia, a dangerous drop in body temperature that requires immediate medical attention. Long-term xylazine use is associated with a range of serious health complications, which can severely impact quality of life. One of the most concerning is the development of severe skin ulcers, which are painful and difficult to treat. These ulcers, often referred to as Ashar or zombie rot, can become infected and lead to tissue death, posing significant health risks. Xylazine can also cause heart problems, kidney damage, and neurological issues, making it a substance with potentially devastating long-term effects. Section 6. A silent killer. Detection and toxicity challenges. One of the most alarming aspects of xylazine is its difficulty in detection. Standard drug tests do not typically screen for xylazine. This makes it difficult to determine its presence in overdose cases. This lack of detection can hinder timely medical intervention. The toxicity of xylazine is another major concern. Xylazine has a narrow therapeutic index. This means that the difference between a dose that produces desired effects and a dose that is toxic is small. This narrow index increases the risk of overdose. The combination of difficult detection and high toxicity makes xylazine particularly dangerous. It often goes unnoticed in drug samples. This allows it to exert its harmful effects undetected. Section 7. A dangerous cocktail, xylazine and opioids. The presence of xylazine in the opioid supply is a particularly alarming trend. Xylazine is often found mixed with opioids like heroin and fentanyl. This combination creates a synergistic effect. This means that the combined effects are greater than the sum of their individual effects. This synergy is dangerous for several reasons. First, it increases the risk of overdose. The combined respiratory depressant effects of xylazine and opioids can easily lead to fatal respiratory failure. Second, it complicates overdose reversal efforts. Naloxone, the medication used to reverse opioid overdoses, is not effective against xylazine. The combination of xylazine and opioids poses a significant challenge to harm reduction efforts. It requires a multifaceted approach that addresses both opioid and non-opioid overdoses.
Section 8. The Economics of Despair, Tranq on the Street. Understanding the economic factors driving the use of xylazine is crucial for developing effective interventions. Xylazine's presence in the illicit drug market is largely driven by its low cost and availability. Xylazine is significantly cheaper than other drugs, particularly opioids. This makes it an attractive cutting agent for dealers looking to maximize profits. By mixing xylazine with other drugs, dealers can increase the volume of their product without significantly increasing their costs. The ready availability of xylazine also contributes to its presence in the drug supply. Xylazine can be purchased online and from veterinary supply stores with relative ease. This easy access makes it a readily available adulterant for those involved in the illicit drug trade.
Section 9. A global crisis, regulatory and international concerns. The emergence of xylazine as a public health threat is not limited to the United States. It is a growing concern worldwide. Reports of xylazine-related overdoses and deaths have been documented in Canada, Europe, and Australia. This global spread has prompted international concern and calls for a coordinated response. The United Nations Office on Drugs and Crime, or UNODC, has recognized the emerging threat of xylazine and is working to raise awareness among member states. Regulatory challenges hinder efforts to control the spread of xylazine. Its legal status as a veterinary drug makes it difficult to regulate its production, distribution, and sale. There is a growing need for stricter regulations and international collaboration to address this emerging threat.
Section 10. Combating the crisis treatment, policy, and the future. Addressing the xylazine crisis requires a multi-pronged approach that encompasses treatment, harm reduction, public policy, and research. Each of these components plays a vital role in creating a comprehensive response to this growing issue. There is no specific antidote for xylazine overdose, which makes the situation even more challenging for healthcare providers. Treatment focuses on managing symptoms and providing supportive care. This includes monitoring vital signs, ensuring adequate oxygenation, and addressing any complications that may arise. Harm reduction strategies are crucial for mitigating the harms associated with xylazine use. These strategies aim to reduce the negative consequences of drug use without necessarily eliminating drug use itself. These strategies include increasing access to naloxone, a life-saving medication that can reverse opioid overdoses, expanding drug checking services to detect xylazine, which allows users to make informed decisions about the substances they are consuming, and providing education about the risks of xylazine-adulterated drugs. Public awareness campaigns can play a significant role in preventing new cases of xylazine use.
Public policy responses are also essential for addressing the root causes of the xylazine crisis. Effective policies can create an environment that supports recovery and reduces the availability of harmful substances. This includes expanding access to substance use disorder treatment, ensuring that individuals have the resources and support they need to recover, addressing the underlying social and economic factors that contribute to drug use, such as poverty, lack of education and unemployment, and strengthening regulations to control the flow of xylazine into the illicit drug supply. This requires coordinated efforts between law enforcement, regulatory agencies, and public health organizations. The future outlook of the xylazine crisis remains uncertain. Ongoing research and data collection are essential for understanding the full scope of the problem and developing effective solutions. However, by implementing comprehensive and evidence-based interventions, we can make significant progress in combating this crisis. We can mitigate its harms and save lives, ensuring a healthier future for our communities.